All right. Can you introduce yourself for the tape?
Yes, thank you. I'm Dr. Michael Osterholm, Director of the Center for Infectious Disease Research and Policy at the University of Minnesota, and watching public health suffer unlike any time in my career.
Yeah, I want to step back here because I think that's an important place to start. Can you set the stakes for us for this moment? I think it's one of those difficult moments where a lot has happened so fast that sometimes you lose sight of where we started and what the baseline was because it's all moving so fast. Can you offer us some just place setting here? How do you think about this moment in context?
Well, let me first of all just emphasize as a matter of degree that I've been in this business 50 years now, and I've not seen anything this dangerous or truly uh, devastating to public health as I see what's happening right now. Uh, just look at the world of vaccines. Vaccines have been the cornerstone of major public health improvements. And it's one that was working very well as a system, with the exception of a very small fringe group that basically is what one would call anti vaccine. Unfortunately, now that group is in control of what's happening with vaccines, how they're being considered for use, are they going to be available, who will pay for them, and even challenging the very notion of their safety and that they're doing more damage than not. That's an unheard of situation relative to the last 50 years of public health.
And in response, we've seen a lot of movement. And in some respects, I think the this moment was born out of an acceleration of this mis and disinformation that emerged, didn't emerge, it accelerated in the pandemic. And we've seen this get married to a broader political project that feels like it's about divorcing our public policy from basic truth. And, MAHA or RFK Jr.'s movement has largely been about doing that in the space of health. I want you, as somebody who's dedicated your career to bringing evidence to bear to public health, to help us unpack what it means when we no longer use science and evidence to make public health decision making.
Well, first of all, it's important to note that that's exactly what's happening. I think you did a very fair job of describing the current situation. Let me just give you one example. When we look at the world of infectious diseases, I think we all can appreciate, having just gone through COVID, that pandemics are without a doubt of major importance to the entire fabric of our world. And when they occur, they will often occur for multiple years. So it's not just like a hurricane where it's one hit that's maybe very severe, but you go into recovery within hours. Pandemics last and they last and they last. And that is in part what causes so much devastation is it just wears down society to the point of, and sometimes irrational and unfortunate things. Well, we know that more pandemics will arrive, and particularly those from influenza and from the coronaviruses. We're due basically for another influenza pandemic, but more specifically, we also have to understand that they could be much worse than anything we've seen to date. Well, if you look at our ability to respond, we can't stop an influenza pandemic from emerging. When it happens, it's going to happen. Our next best opportunity to have an impact is having vaccines on hand that can be readily distributed, that are effective, that work, and they are able to be available to the world. Well, right now, if you look at our influenza vaccine manufacturing capacity, unfortunately, it's not a lot different than it was decades ago, using pretty much the same old technique of growing it in chicken eggs, which, if anybody understands how complicated that is, it is. Well, mRNA technology, the platform that we use to develop the COVID vaccines, and one that we're exploring for a number of different infectious diseases right now, as well as cancers, offered us the possibility of changing that. Right now, using the current technology, if we had an influenza pandemic, we could only make enough vaccine for about a quarter of the world in the next 15 to 18 months, a quarter of the world. If we, in fact, had a mRNA vaccine available and we were prepared to use it quickly, we could make enough vaccine within a year for the world. Now we're talking about hundreds of thousands to millions of lives that would be lost unnecessarily because of the fact that our government just made a decision to divest itself of all mRNA vaccine work. This is unfathomable in the sense that there were no data presented to demonstrate why. We have demonstrated time and time again the safety as well as the effectiveness of these vaccines. On top of that, then the explanation that came forward after the declaration was made that we're withdrawing this support was, well, on the other hand, we're just going to do this because most of the public don't trust these vaccines and they wouldn't use them, so why invest in them? Well, so much of the distrust around these vaccines came from the very people who are now deciding that we won't make it available. So there's just one example that it may seem abstract, but it won't be one day. It will be millions and millions of lives lost unnecessarily. And that, I think, is the challenge we have going forward.
You've decided to step up and do something about it. And, you've been doing this work for a very long time at the University of Minnesota. Your organization has become one of the mainstays of providing basic information to the public. But you're taking it a step further, right? We've watched as this same administration has, in effect, deconstructed or gutted ACIP, the Advisory Committee on Immunization Practices, which has created a situation in which we can no longer rely on the federal government to provide us expert guidance because they basically fired all the experts. And so you've recognized that we need this, and there's a lot of downstream public policy that has to get made, whether it's at the local or the state level, or it's at the insurer level or the clinician level. And you've embarked on this project called the Vaccine Integrity Project. Can you tell us a little bit about the goals of this project and the need to do this now?
Well, first of all, let me just say, I wish every interview was as informed as you are, because you really laid out a very nice foundation for me to draw upon. Let me just tell you a little story. I think it ties it together. On the night of the election, I, realizing that Mr. Trump had won, went and pulled out the 2025 document that I had and went through those sections of it that dealt with public health. And I recognized at that moment that we're in for a really very, very different experience. I'm 72 years old. People are all expecting me to retire. And after I read that, I sent an email out the next day to my staff saying, you know what, I'm here for 4 more years for sure. I can't leave, okay? And out of that mindset came the Vaccine Integrity Project, because we knew vaccines would be heavily attacked. Mr. Kennedy was announced as the designate for Secretary of HHS, while not yet confirmed. It looked like he would get through. And so in mid to late November, I wrote an op-ed piece in the New York Times with Zeke Emanuel, and we laid out, do you realize what he's going to do to your vaccines? And I think at the time, people just didn't really understand that. Well, of course, now it's starting to play out. And I think that the fact of the matter is that we are now in big trouble. So one of the things that we did at our center is created the Vaccine Integrity Project. It was really an attempt to say, first of all, find out what is it that people need in terms of information or actions that are not going to be available now if the ACIP is no longer in existence, which a lot of people said, oh, that'll never happen. It happened, as you pointed out. So one of the things we did is we were able to secure funding from the Alumbra Foundation, Christy Walton's personal foundation. So we have no bias, no conflicts of interest there. And we held a series of 6 major focus group meetings around the country in the vaccine enterprise world and said, what is it that we need to do if the federal government is not there? And one of the things that came up with is we just need good, solid information upon which to make recommendations for vaccines, because if they are not going to provide that information, as the ACIP did in the past with CDC. So we brought together a group, 24 experts, all who are incredibly talented, who are willing to do this work without pay, who basically came together from Boston, from New York, from Philadelphia, from Minneapolis, from California, and several locations, and said, okay, what can we do to do what ACIP otherwise would have done? And that means we went and did these very detailed protocol-based research projects to look for all the things that had been published on or mentioned of since the last time the ACIP looked at coronaviruses, i.e. COVID, looked at influenza, or looked at RSV vaccines. And what we did then is put together this team, and we ended up identifying over 17,500 pieces of information. We had to go in and two people objectively looking at this to determine, does this provide us any information? Well, eventually we weeded it down, and to the point now where we're summarizing our results. And we actually had a major event just this week where, as we did a live stream to almost 1,700 people, presenting our data and what we have found, with a panel that included the editor of the New England Journal of Medicine, the Fox News medical correspondent, one of the leading voices in epidemiology in the country, as well as a former member of the ACIP. And yes, and they then reviewed this information with our individual presenters, each step of the way, asking all these questions. That information has been provided to the medical societies that otherwise would make recommendations. Remember, ACIP would review the information. They would make a basic set of recommendations, but it's the American Academy of Pediatrics that decides really what we should do with children. It's the ACOG, which decides, in fact, how do we deal with pregnant women? Infectious Disease Society of America, how do we deal with the immune compromised? And so we shared this information, and actually earlier this week, the American Academy of Pediatrics came out with their recommendations based on, in part, what we did, and shared that with them. We are now taking on additional vaccines besides those three. We did those because as seasonal viral pathogens, these are the first vaccines that were up. They're also the ones that the Secretary also has made decisions about, such as taking COVID vaccines away from pregnant women, which we have demonstrated two things. One is they are at an increased risk of serious illness with COVID during pregnancy. And two, the vaccines do a damn good job of helping them avoid that. And so despite the fact that the Secretary has already said he's taken them away, we found the data. The American Academy of Pediatrics confirmed the data for younger kids. And so this was one of those issues of the coalition of the willing. This was a group of individuals that wanted to contribute, expert individuals in terms of their knowledge on vaccines and infectious diseases. And we're going to continue this project. We're going to continue to be, if nothing else, the factual source of information that people can count on, that is objective, it's nonpartisan, it's just, as they would say back in the old ball game, just calling balls and strikes. That's all we're doing.
Yeah, no, we really appreciate it. And one of the panelists on that live stream was our esteemed co-host Katelyn. So appreciate that. And I wanted to just break this down for a lot of folks, because what we now have is the government's ACIP that, of course, was gutted of the traditionally vetted experts and fully reappointed from RFK Jr. that has, in effect, become a platform for some of the worst mis and disinformation available. And then you have the Vaccine Integrity Project that is offering an evidence-driven, transparent accounting of what we know and understand about the impact of vaccines. But now you still got 2 points of potential perspective. One of them has a lot more power than the other, right? Which is the federal government. The other one has the power of truth, which, in a fairer world should matter most. How do you build out more support within a lot of these communities? Because you talked about the American Academy of Pediatrics making a decision founded based on your transparent accounting of the evidence. But you can imagine other organizations, particularly those that have other equities in the healthcare process, being in effect bullied into giving more of a platform to the HHS certified new pseudo ACIP. So how do you think about what that means now? And then what does it mean to have to oppose the federal government on things that for a long time we took for granted would be done with the basic interest of the public and truth at heart?
Well, let me first start with just the context piece, because this is really an important question you've asked. When you ask about taking on the government over an issue, what we've done in the past is it's been based on assessing science. And someone agrees or disagrees that this is a problem, this isn't a problem, what does it mean? Remember, science is not truth. Science is the pursuit of truth. And it's an important concept to know that we're going to keep learning. One of the challenges we have now is we don't have anything to debate with this group other than the fact that they just dictatorially came down the line and said that this vaccine is not going to be available. I mean, even if you look at the decision to not fund all of this mRNA work that we just talked about, that was announced in a short video that the secretary did saying that he was taking these, no longer supporting these and taking this research aside. And he said it because of the fact that the benefits were far less than the risks, that these vaccines weren't safe, of which no data existed to support that, okay? But then realizing that wasn't selling very well, 5 days later, the director of the NIH gets on the public stage and says, well, actually not true. We're actually going to not support this vaccine research because nobody in the public wants these vaccines, and why waste the money? Well, wait a minute. Which is it? Is it because they don't work and they're harmful, or is it because of the public relations? Of which, by the way, they themselves are of the making why people do have concern about the vaccines. But it's hardly the majority of people in this country. Many people would literally do anything to get a dose of a mRNA vaccine during a pandemic as opposed to dying from it. And so one of the challenges we have is, how do you argue or disagree or try to reconcile things that are just value statements that float, where one day it's this, the next day it's that? It's not about a body of data. Have you seen any data presented at all by any of these groups that actually challenge this notion? So this is what's created a hard issue for us in science, is how do you take something on like that? It's like I'm taking on a ghost, you know? And so I think that's the number one thing, first of all. The second thing, though, is in your question, you know, I believe that the VIP is really two things. One is, it is doing the science as the science should be done. And as you so well illustrated, it's about transparency. It's about well-defined terms and how you're doing the work and how people measure it. You know, an inch to us is an inch. It's not an inch, or maybe it's a foot. No, maybe it's 10 feet. No, it's an inch. And so we've been very precise about these things. And what I think, however, besides doing that, it's also giving people a sense you can resist, you can come back, you can take it on. And I thought yesterday, when the American Academy of Pediatrics came out with their recommendations, and then the Secretary's office responded with that horrible email, you know, basically almost accusing them of selling out, you know, that they did these recommendations for some kind of consideration. They stood up to them at the White House and at HHS in a way that was very professional. If nothing else, it should give them an example for the rest of our community out there. You can stand up and you can take this position and you can move. Now, why is that important? Because it's not just the fact what recommendations are made for vaccines by us, but because for all these years, many of the recommendations that allowed for payers to pay for these vaccines originated from the ACIP. And in some cases, there's actually legal terminology involved with you know, the laws and the ordinances and so forth that actually say you can only purchase vaccines or have to purchase vaccines approved by the ACIP. We've been working concurrently with both the societies and also the payers to look at, is there a way that we can get around this so that if we can come up with a body of science that supports these vaccines, you can use that as justification for why you should pay for them. So you leaving the ACIP approval as kind of the basement, but using our work as kind of the ceiling to say, yeah, we can get there. So we're trying to accomplish one really important thing. And the fact is that people will be surprised when we say vaccines aren't that important. Vaccinations are everything. It's when that vaccine is being used, it's when it's in the arm, that it becomes so important. And so we're trying to help support the infrastructure to not only have the information that you can use to make the recommendation, but the information you can use to make the justification for why payers should pay for these vaccines.